January 1870. England's Victorian asylums were about to face their darkest secret, a scandal so horrifying it would shake the very foundations of psychiatric care and expose a trail of broken bones, suspicious deaths, and institutional cover-ups that haunted Britain for decades. The nightmare began with Rees Price, an elderly patient admitted to Crichton-Browne Asylum. He died shortly after admission, but it was his post-mortem that sent shockwaves through Victorian society. The examining physician found 8 broken ribs, yet Price had received no proper examination upon admission, no special attention when breathing became difficult. But Price wasn't alone. Santonistri had died at the prestigious Hanwell Asylum in October 1869, with 8 broken ribs and a shattered breastbone. Days later, William Wilson at Lancaster was found dead with 12 fractured ribs. The pattern was becoming horrifyingly clear. Patients were entering asylums alive and leaving with bones systematically broken from the inside. Charles Reade, author of the asylum exposé novel Hard Cash, wrote a damning letter to the Pall Mall Gazette. He claimed asylum attendants routinely subdued patients by walking up and down on their knees, essentially crushing their rib cages under their weight. Former patients emerged from the shadows with testimonies of attendants kneeling on defenseless inmates. The British Medical Journal published a devastating piece listing case after case, describing rib crushing as the favorite mode in which lunatics were hurried out of existence. At the West Riding Pauper Lunatic Asylum in Wakefield, the evidence was mounting. Henry D., a patient with dementia and general paralysis, had been noted to have yellowish-black bruises upon admission. He was restless, moving his bedstead around his room and climbing on it to reach ventilators. Weeks later, after breaking through a glass door, an examination found broken ribs and pleurisy. He died days afterward. The post-mortem revealed 7 fractured ribs that had been inflicted weeks before his death while he was supposedly under care. The coroner's records from Wakefield, spanning 1834 to 1879, contained 384 cases, with 44 mentioning fracture as a cause of death. But these were only the cases that came to light. How many more died with broken bones that were never properly examined? What made these deaths particularly sinister was the pattern. Patients were found with multiple rib fractures that couldn't be explained by simple falls. The breaks were too extensive, too systematic. Yet asylum staff claimed patients were accident-prone due to their mental conditions. Thomas S., diagnosed with acute mania, suddenly ran down a gallery, kicked over a bucket, and fell. He seemed unhurt, even eating breakfast afterward. But examination revealed several fractured ribs. The coroner's verdict? Death by accident while in an advanced stage of general paralysis. The medical establishment fought back desperately. They claimed patients with general paralysis of the insane had brittle bones, impaired reflexes, and dulled pain sensations that made them injure themselves. Postmortems revealed bones so soft they could be snapped between 2 fingers or tied in a knot due to their incredible flexibility. Dr. James Crichton-Browne at Wakefield established a laboratory specifically to study these mysterious bone conditions. They diagnosed mollities ossium, a softening of the bones that supposedly explained why asylum patients fractured so easily. But the scientific explanations felt hollow. Why were these bone conditions only found in asylum patients? Why were the fractures always ribs the bones that would break if someone knelt on a patient's chest? Charles Mercier, determined to prove asylum staff innocent, invented a special device to measure bone strength. He mass-produced these instruments and sent them to asylums across Britain, demanding systematic testing of every dead patient's ribs. The results were damning in unexpected ways. When Mercier's device measured the bones of asylum patients against those of general hospital patients, there was almost no difference in strength. The brittle bone theory was scientifically unfounded. Yet the bone testing continued in secret for decades. At Wakefield, breaking strain was systematically recorded from 1895 onward. Pre-printed post-mortem certificates contained a pointed reminder: describe ribs in every case, Evidence of an institution. Wide obsession with covering up the truth. The families of the dead whispered different stories in tenement hallways. They spoke of cost-cutting measures, of warnings ignored, of attendants using violence to control difficult patients, but their working-class voices were drowned out by medical authority. Francis Simpson, compiling pathological statistics at Wakefield, found that 60% of asylum patients died from infections, 15% from exhaustion, and many showed signs of cardiovascular disease conditions consistent with chronic stress and trauma. Official inquests repeatedly ruled these deaths accidental, but the patterns suggested something far more sinister. Patients with bruises on admission, fractures that predated reported accidents, and injuries that staff claimed went unnoticed despite their severity. The scandal influenced attendant training manuals for decades. Handbooks explicitly warned against kneeling on patients and emphasized reporting any signs of injury, acknowledgments that these practices had been occurring regularly. The Breaking Bones scandal gradually faded from public attention, but the institutional memory remained. Asylum staff learned to be more careful, more subtle. The systematic documentation of rib strength continued well into the 20th century, a testament to decades of cover-up culture. Today, researchers examining Victorian asylum records still find evidence of suspicious deaths, unexplained fractures, and medical explanations that don't hold up to modern scrutiny. The broken bones of Victorian asylum patients weren't symptoms of disease. They were symptoms of a system that saw the mentally ill as less than human. Some secrets break bones. Some institutions break souls. Some scandals break the silence that protects the powerful while destroying the powerless. Subscribe to the Midnight Whispers for true horror from forgotten files. One unforgettable story. One haunted night. Dare to join us?